Hi, my name is Allie, and I like to explain what your test results suggest and discuss our next steps. Based on your symptoms of fatigue, dizziness, shortness of breath with activity, weight loss, and your lab results, you have anemia, which means your blood does not have enough healthy red blood cells to carry oxygen efficiently. Your hemoglobin is 8.7 grams per deciliter, which is well below the normal range for a man, and your red blood cells are smaller than normal, as shown by your low mean corpuscular volume, or MCV, of 70 femtoliters. This type of anemia is called microcytic anemia and is the most common cause of iron deficiency. Iron is essential because it helps your body produce hemoglobin, the protein inside red blood cells that carry oxygen. When your body does not have enough iron, it cannot make enough healthy red blood cells, so your organs and your muscles receive less oxygen. This explains why you have been feeling tired, weak, dizzy, and short of breath. The next important question is why you are iron deficient. In men over the age of 50, iron deficiency anemia is often caused by slow blood loss somewhere in the gastrointestinal tract, or your GI tract. Even when there is no visible bleeding. Your occasional use of ibuprofen may contribute because medications like ibuprofen can irritate the lining of the stomach and intestines and sometimes cause bleeding. However, your unintentional weight loss and decreased appetite are also concerning. These symptoms mean we need to carefully evaluate for other causes, including stomach ulcers, colon polyps, and colorectal cancer. This does not mean that you have cancer, but it is important that we investigate because finding the cause early leads to better outcomes. To determine the cause, your healthcare provider will likely order additional blood tests, including iron studies, ferritin levels, and possibly a stool test to look for hidden blood. You will also likely be referred for a colonoscopy and possibly an upper endoscopy, or EGD, to examine your digestive tract for any source of bleeding. Diet and nutrition are also important. Foods rich in iron include lean red meat, poultry, fish, beans, lentils, spinach, fortified cereals, and leafy green vegetables. Vitamin C also helps your body absorb iron, so eating foods like oranges, strawberries, tomatoes, or bell peppers, along with iron-rich foods, can improve absorption. On the other hand, drinking tea, coffee, or consuming large amounts of calcium at the same time as your iron-rich meals can reduce iron absorption, so balance is key. There is also a relationship between genetics and anemia. Some inherited conditions, such as thalassemia, can also cause small red blood cells similar to iron deficiency anemia. If your iron studies do not clearly show iron deficiency, or if there is a strong family history of blood disorders, additional testing may be needed to determine whether genetics are contributing to your anemia. Genetic factors can also influence how your body absorbs and uses iron. If iron deficiency is confirmed, your provider may provide oral iron supplements. These work best when taken on an empty stomach or with vitamin C. However, they can sometimes cause constipation, nausea, or dark colored stools. It is important to take them exactly as prescribed and not stop them once you start feeling better, because rebuilding your body's iron stores can take several months. You should also avoid take ibuprofen or other nonsteroidal anti-inflammatory drugs unless your healthcare provider recommends them, because they may increase the risk of gastrointestinal bleeding, as we discussed earlier. If you notice black stools, vomiting blood, severe abdominal pain, chest pain, worsening dizziness, or fainting, seek immediate medical attention. The good news is that anemia is often very treatable once the underlying cause is identified. Our priority is not correcting your low blood count, but also determining why it develops so we can prevent it from happening again and addressing any serious underlying conditions as early as possible. Please let me know if you have any questions. I know that was a lot of information. We will work together to develop the best treatment plan for you.